and creating a test. I'm going to walk you through this test, and we're going to show you all parts USMLE style and COMLEX style. So you'll notice that every time I show you something for the USMLE, I'm going to show it very clearly on the COMLEX side as well. So when you're going in to create a test, you have the opportunity to choose subjects and then drill down to systems. You'll notice on the right-hand side under subjects is where you will find the COMLEX supplement. So on this, you'll see both of them, the OPP and the OMT questions that are available. From there, you can go in and you can choose the systems. And from there, you can actually drill down into the subtopics as well. You can actually do this on a very high level, or you can choose very minimal questions if you only have a little bit of time to work through. And last but not least, you'll be able to choose the amount of questions you want to work through. The max allowed per block is 40, which I do understand follows the USMLE exam. And I know that the COMLEX exam allows for 55 per block, but UWorld just specifically has a max of 40 for these tests. All right, so let's get into interface options. Within the UWorld question bank, you have 3 interface options that you can choose from. The one that's currently on your screen is the NBME style interface. So it's retro. This is what you're going to see when you sit down to take the exam, which is going to reduce your level of anxiety first. So as you go through and work through this, whether it's in the NBME style interface or the NBOME, that's your first way that you can reduce some of that test anxiety. So it allows you to sit down for that exam as if you were just sitting down to go through a few UWorld questions. So let's look at the NBOME style. So you'll notice that the font matches the NBOME style, the style of question, where all of the flashcards and notes and settings and timer are, all matches the NBOME. And last but not least, you could choose the UWorld interface, which just removes all of those other functions and allows you really just to focus on the subject of the question and the answers. The next thing that you have the option to choose from is split screen explanation. We think that this should always be utilized in tutor mode because it allows you to go back and on the left-hand side of the screen, always see the question, the vignette, and the answers at hand. And then on the right-hand side, it allows you to still see the explanation, and you can always reference back and forth between the two. So let's go ahead and go through one of our first questions. This is a USMLE question. So I will give everybody just a couple of minutes to work through this question. Okay, for those of you who were concerned, that was only 60 seconds. On the NBME, you would usually get 90 seconds. But let's go over this question. So we have a 34-year-old woman who has been presented for tuberculosis evaluation. Her father living with her has active pulmonary tuberculosis. She gets tested. Her initial skin testing was negative, but 8 weeks later, she tested again. No symptoms, normal physical exam, but her skin test is positive. Her chest x-ray was normal. So the question's asking, what immune effector cells helped control tuberculosis so she did not develop the active disease? So for those of you who thought the answer was B, CD4 T lymphocytes and macrophages, you got this question correct. In tutor mode, you'll notice that every single time you will know whether you got the question correct or incorrect, how many other people answered this question correctly, how much time was spent on it, and if you were really curious on how long this question has either been in the question bank or when the last time it was updated, it will actually show you that information as well. But let's go through the explanation. So most of our explanations, we will always try to include an illustration, table, clinical or radiographic image in the majority of all of our explanations. So you'll notice on this one, I'm zoomed in on the right-hand side, it walks you through the entire question and why it is answered the way that it is. Next, you'll see our written explanation. And we go through our written explanations in 3 different ways. So we go through our written explanations with the correct answer choice, the incorrect answer choice, and our educational objective, which is just a 2 to 3 sentence summary. You'll notice that we go through this 3 different ways. You get subtle but impactful repetition. We have strategic boldface font throughout. And then as you go through, you'll also know that there are hyperlinks for you to take it just a step further. This does not take you outside of the UWorld question bank, but it allows you just a little bit more information that wasn't necessarily enough information to include in the written explanation. All right, so let's go through an OMT style or an OMT question, which is an MBOME style question. So you'll notice that this is presented in a little bit of a different format. Instead of you seeing all of the information up front, it actually gives you bullet points, which allows you to look for clues to get to a better answer. So I'll give everybody a moment to work through this question. Okay, for those of you who chose answer selection E, you are correct. So let's, as we went through the explanation in the MBME style, let's go ahead and go through the MBOME style explanation. So you'll notice these are presented in a similar fashion. We'll always still have that triple tell method. You will always see some sort of visual that will walk you through this. You will also always see a written explanation, again, with the correct answer choice, as well as the incorrect answer choice, and the educational objectives. You'll notice in this written explanation that you'll see several hyperlinks. These will be very valuable to you as this will actually break down things a little bit further in the OMT concepts. Just a few more examples for you. Perfect. Okay, so the next thing that we wanted to highlight during our time with you today was our flashcards. And these are really valuable when you don't have time to work through questions and or the question bank. We allow you to go through and make custom flashcards throughout your time that you're using in the bank. And you can always go back and reference these. So how you go about making a flashcard is anytime you're on a question and you feel like it's valuable information that you want to put into a flashcard, you would simply find the lightning bolt Specifically on this one, it's in the upper left-hand corner. You would click on the lightning bolt. It will automatically bring up a flashcard. And then you can actually right-click, copy and paste any relevant information that you want from the actual question and or add your own notes in this. From there, you'll be asked to tag it. Tagging it will allow you to start to set up and create decks of flashcards for you to go through and study. When you're studying, you'll notice that when you go through, you'll be asked to grade the card again, good, and easy. And what this does is helps you start studying with spaced repetition. Those those flashcards that you have clicked, again, you will start to see more frequently until you have mastered that information. And as you have mastered it, then you would grade it either good or easy, and you would start to see it less frequently. You will, of course, see all of the information over and over again, but depending on how you've graded it, will rate on how fast or how many times you have seen them. The next enhancement we like to focus on is your electronic notebook. And that is exactly what it is. So it is a one-stop shop for all your note needs. So whether it's in the UWorld question bank or whether it's from lecture, this could be a place where you house all of your notes. So there's only one place you're going for all of your test prep needs. So let's go over how to monitor your performance and really get the most out of it, because this can be quite overwhelming. One of the #1 questions that we always get is your percentage. What percentage do I need to be at to know that I am going to be successful on either of these exams? You will see a lot of things out on the internet that will tell you things all over the place. But as long as you're sitting between 65 to 75%, you are in a very, very good position. That would put you above passing. If I'm just being honest, 40% is ideally a passing score, but nobody really wants to be at 40%. So we always recommend if you're sitting 65 or above, you're sitting in a really good place. You can go over all of your reporting by subject and system, as well as looking at previous tests. We don't recommend you going through previous tests until you've worked through the entire question bank at least one time. All right, so let's get through how to manage your test anxiety. And what does that look like? Well, that looks like how you study. So ideally, we would love for everybody to purchase this at least a year before they are going to sit for the exam. So during that time that you're not in dedicated, you're taking that systems-based approach, you're going slow and steady through the bank, you're really building your foundation very strong and slow. What then would happen is when you get to dedicated study time, you would reset your bank. You would clear all of your data, all of the questions that have been answered, and you would really focus then on going through the bank in timed mode, keeping that time within the time frame of the test that you're dedicated to studying for at that time, and really working through your weaker areas first, and then continuing to go through those successful areas as well. So again, just to go over that, how we recommend doing that in the 3 steps is start early and practice often. Aim to go through the bank 2 times. As I mentioned, getting the subscription in enough time before dedicated that you can actually work through it alongside of your classwork. But then when you get to dedicated study time, you're working on it as if you were actually sitting for the exam. And last but not least, customizing your bank with the flashcards and your notebook. All right, so I am going to hand it over to Elite Medical Prep now. And again, if you have any questions, please feel free to chat, use the chat bar, and we will open it up at the very end, again, to take you live Q&A.
Kelly, thank you again for a fantastic introduction and for those slides. I'm now going to take you through some additional slides. Again, my name is Marcel Bruce Raymer. and I'm one of the co-founders of Elite Medical Prep. And you're also going to be meeting Dr. Caleb McIntyre and Dr. Jim Devaney, both of whom we're really lucky to have here today. And Kelly's already introduced us. So without further ado, we'll continue on with our presentation slides. So Kelly, again, I want to thank you for inviting us to UWorld. I want to remind everybody that at UWorld, Elite Medical Prep, which I helped found, we specialize in working with students and with medical schools on the COMLEX and USMLE, as well as shelf exams. We also do tutoring services for the MCAT and for post-residency board certification in several specialties. And our team is comprised of highly trained MDs and DOs, as well as MD and DO candidates from top medical schools. And we work with many thousands of students throughout the US, Caribbean, and multiple foreign countries. We've also developed institutional partnerships with a number of schools, including Mount Sinai and UNLV, where we provide official courses for the USMLE. And of course, as I mentioned, Dr. Caleb McIntyre and Dr. Jim Devaney are going to walk you through some really high yield tips you can use for test anxiety, and also just generally great for working on through these multiple choice exams. I guess we're going to start off with Dr. McIntyre. Caleb, do you want to take it away?
Absolutely. And I want to start my video up. I think I need a permission from the main host to start that video, but I'll get started in the meantime. So my name is Caleb McIntyre. I am a fellow in neuroimmunology and neuroinfectious disease at Mass General Hospital. And I'm also the director of medical education at Elite Medical Prep. Been working with the company for about 4 years now. I work mostly with students who face specific learning challenges, things like ADHD, dyslexia, history of TBI, but I work very broadly with any students who come through as well. I'm also just a nerd for med ed research, so I will talk a lot about the kind of literature base around what learning we do. There we go. Okay. Hi, everyone. I got the video up here. So I just want to frame what we'll be talking about today, that a lot of things I'm going to be discussing are cognitive reframing techniques, right? They're not magic bullets. They're not things that are going to fix your test anxiety in one day. But if any of you have done CBT or any sort of cognitive therapy like that, that's the general approach that we're taking, right? Where we're trying to make this slow and steady progress as we go through the test questions on how we're approaching them and how we're framing them internally. So the first point I want to cover is testing anxiety, which is not fun. We've all been through testing anxiety, right? We're all in the medical fields, and we know that it's pretty crummy. That said, I want to try reframing it that it's not actually bad in terms of your learning. So we have good research that I'm familiar with, both through my role as the director of medical education and in my work as a neurologist, that the kind of functional brain connections that underlie memory are reinforced by low to moderate levels of stress. If you get too high into the stress spectrum, yes, that will impair memory. But something that you can try reminding yourself of as you're going through test questions is, if you're feeling that little jolt of anxiety, if you're feeling like that ooh in your stomach, that could actually be helping the memories form. So again, a reframing technique to try and turn that anxiety into something that's not as bad. And of course, if you feel like you're spiraling out, you feel like you're getting into that higher level anxiety, it's important to give yourself a quick break, maybe take 5 minutes, recharge, and then come back to it in a more centered place. And moving on to the next slide here. So the one practical point is that we have really good evidence that students who memorize in the context of low-level stressors, and we have this evidence both for medical students specifically and for a number of other schooling techniques across the spectrum of learning, we do see increased memory from these low-level stressors. On to the next slide. We have a few other ways that these are ones that I use with my students all the time, like daily. So a few ways that we can cognitively reframe. One, keeping that practical level in mind. Second, humanize the questions. So this is a very real thing that I know some of the folks who write NBME questions, and let me tell you, people who are writing questions are in medical education, and people in medical education are doing that because they really love it and they want you to succeed. No one's in it because they're like, ooh, the money's in med ed. Yeah, like that's what I'm going to do. No, they're doing it because they really love teaching. So try to remember that any question you read, whether it's on UWorld or on the NBOME itself, on level 1, level 2, try to remember that this is written by a real person who actually wants you to succeed. So it's not an impassable obstacle. It is something that they wanted you to get through, a puzzle to solve. So all of this is to say, reframe stress whenever you can. Again, I know that sounds kind of silly in some ways. It sounds really hard because it's just a stressful situation, but we're not trying to make stress pleasant. We will acknowledge it feels bad, but also try to reframe that it can help our memorization. And if we move forward to the next slide, just a couple practical approaches that I have too, in addition to the reframing. So the skip 10 approach is a good one for test anxiety. So you would start with question number 11, and on level 1, you would go 11 through 50, and then back to 1 through 10. Clearly, you're doing exactly the same number of questions here, but just the initial jolt of seeing 50 questions all in a row can be a little bit more intimidating. I've found many students who find that it just feels a little easier if they have this initial block of 40 questions and then they polish it off with 10. You can also experiment around with, you could start with question 21 instead of 11, but just to make it seem like it's more manageable bite-sized blocks. Some students I've worked with have also just taken each block of 10 as trying to conceptualize it as its own mini test. And then a second technique here is skipping long questions. So I call this the bucket question technique because we're just saying, you know what, every once in a while, you got to take a question that you feel really unsure about, throw it in a bucket to the side. We're just not going to worry about it. So if you see really long questions or questions that you know are areas of weakness for you, say it's one of those biostats questions with an ad built in, you know that you just take way too long with those. Skip that. Pick an answer randomly, just so if you don't get time to go back to it, you have something picked. It could be just A every time, completely random. Pick it, flag it, come back to it at the end. If you're doing something like 3 to 5 questions like this per block, you're going to be in a really good position to spend that extra time you would have spent stressing on these long questions, effectively answering several shorter questions or ones that you're more sure about. And then if you have time at the end, great, you'll still come back to them. But if not, you at least have something randomly chosen. And I think with that, I can pass off to Jim, who will walk you through a few slides. I'll pop back in a few, but Jim?
Thank you very much, Caleb. As Caleb said, I'm Jim Devaney. I've been tutoring with EMP for about 4.5 years and recently started working as the company Comlex DO team leader. So I'm very happy to be here today. I'm just going to go through a couple of practical implications of things that Caleb was just talking about, specifically his last point, and how we have our students go through questions. This is our 4-step approach, and it's a modification of our standard 4-step approach to all multiple choice questions that we've presented previously. So you may notice some similarities if you've seen this talk before. So first off, we start with reading the last line of the vignette to frame ourselves and see where we're going with this question. Next, you read, you review the answer choices to again continue framing this question for you. And step 3 is where you decide if you'll answer this question now or later. So this question is moderate in length, not short, not too long. It's focused on neuro and MSK, which tend to be a strength of mine. And I would decide to answer. So at that point, we would go back to the STEM, we would read it in full, and then we would choose our answer and move on to the next question. So next up, we will talk about this question STEM here. So this is one, same moderate length STEM. We'll start with our 4-step approach here. So step 1, last line of the question. Step 2, reading the answer choices, which this type of answer choices tend to cause a lot of anxiety for me. There's a lot of arrows, a lot of decisions within each answer choice. And then using that information, we will decide in step 3 if we're going to take this question now or answer it and move on. So since this is one that would cause me more anxiety, this was one that would likely take me longer time and take away from future questions, I would decide to pick an answer, flag it, as Caleb said, and come back to answer it later in the block if I have time. And again, it's important to put an answer in these questions that you're, even if you aren't going through the entire process of answering them, because then it gives you at least some chance of getting this answer correct, whereas leaving it empty would not. And then flagging it so you can find it easier later. So next up, this is just the two images superimposed on each other to kind of show them different side to side. And then again, just re-highlighting our 4-step approach. So next off, I am going to briefly hand back to Caleb, and he'll give us some more practical techniques for studying.
So this is another part of that cognitive reframing that we've discussed. And this is one more piece just to remind yourself of the good stuff. Now, this is something that I know sounds a little facile and can be really tough in the moment, right? Test studying is really tough. It's stressful. All of us are presumably here because there was something or some things that we loved about medicine, right? We love the patient care. We think it's really fascinating the way the body works. There are some things that drew us in. Try writing down literally one thing. It could take 30 seconds at the end of each day. That's not focused on being high yield. It's not focused on any of that. It is simply something you really liked or you found cool, something where you're like, huh, I didn't know kidneys did that, or whatever it is. Just try to reconnect yourself with a little bit of why you like what you're doing, because it can be so easy to get lost in that mire of just test stress, factoids. Try to broaden yourself out and take yourself out of that just a little bit at the end of each day. And Jim, you can, I'll pass it on back to you.
Thank you, Caleb. So this last little section of mine, going further with a little bit more of strategies in how you approach your studying for boards. So as we've been talking about throughout this talk so far, questions are extremely important, and determining when to start these questions is also extremely important. And so our recommendation is starting them as soon as possible and giving yourselves ample time to complete 2 full passes through the question bank of your choice. This gives you all the opportunity to see all the concepts multiple times and keep you or get you ready for test day. One thing to think about is that we often avoid things that are uncomfortable and scary, and that can be applied to questions like UWorld or other Q banks that you might choose to use. But the avoidance of these things further amplifies that feeling as the longer we go. So it's important to kind of push yourself into that uncomfortable situation, so that when it comes to test day, it is less of a hindrance. That goes for questions, that goes for topics, that goes for kind of all things as you're prepping for these exams. So next slide. And this will be my last slide here, just kind of another step into mindfulness and kind of a way of reframing and getting yourself recentered, whether it's on studying days or whether it's on test days. And it's called box breathing. For those who aren't familiar, it became very popular recently on social media and other platforms. It's used from people in high school to Navy SEALs, and they've noted the benefit during moments of high stress. So whether that be on the battlefield or in the exam room, like on Comlex or USMLE, you can use this either once or multiple times until you feel the desired effect, and you can continue. So I'm going to walk us through here. First off, I'm just going to describe it to you if you haven't heard of it before. So step 1 is breathing in through the nose for a count of 4. Step 2 is holding that breath for a count of 4. Step 3 is breathing out for a count of 4. Step 4 is holding that out for a count of 4. So let's do this together. real quick. So starting on inhale. Starting 1, 2, 3, 4. Hold. 1, 2, 3, 4. Exhale. 2, 3, 4. And hold. 2, 3, 4. Thank you very much. I'm going to hand this back over to Dr. Bruce Raymer, and he can close us out.
Hi, everybody. Jim and Caleb, thanks so much for taking us through that. That was excellent. And I did a box breathing that always helps lower the energy level. Sort of, you can feel the heart rate go down just a little bit when you do that. I like to do that actually once or twice in a row in a cycle, and that can really be helpful. And I've seen the effects. And I actually know a couple of Navy SEALs that they've said that this really works. Also, I've seen it work with kids, which I have a few of. So thank you so much again, Jim and Caleb, for that. I'm just going to finish up with a sort of last slide before we get to our Q&A. And I know you guys have some great questions that are building up, so please put those in. And this is a slide we've shown a number of times. This is our pyramid of resources. And I want to bring this up again in this context because we've been talking about anxiety reduction. We've also been talking about QBank usage, and the two go hand in hand. And this slide here is emphasizing the following, that when we think about how we're going to structure the use of our resources, we've just shown you that you can develop anxiety techniques that you can combat your test anxiety with on the QBank, but you have to use the QBank to actually practice those things. Additionally, as we can show in this diagram, questions and the review of those questions is really one of the most active and most effective forms of learning. We've found, and we've restructured the way we've been working with our students over the last number of years, that focusing on a question-based format of learning, that's whether you're learning on your own or in a group session or in a one-on-one tutoring session, is really the most effective way to use your time. And of course, as we noted in a prior slide, trying to focus on those areas that are uncomfortable or you feel a little bit more stressed about is a great way to help tackle that. So you're going to help build learning in those areas. Questions are really the most efficient and effective way to do that. And we want to always focus on active learning resources. Of course, if you look at the next thing up in our pyramid, next sort of core of our pyramid is going to be flashcards. And of course, I don't know, this is not covered as deeply in this presentation, but in other prior presentations of UWorld, we've talked about the flashcard feature that they've integrated. That's an excellent resource as well. Again, it's a very active resource. And it's an excellent way to improve your learning. Of course, there are less active resources that are also excellent, such as visual memory aids, video podcasts, and reading. But we want to limit those things. We want to really spend the majority of our high quality energy and time on the active learning resources, questions and review, and flashcards, as we've discussed. Okay, that is all for us. We're going to now go to the Q&A, and you've seen this slide earlier when Kelly showed you this. And we have a Q&A function here. We're going to open it up to all the questions that we have out there. And thank you for attending so far. We're going to stick around now for about another 20 minutes to answer your questions. And we have the three of us, as well as Kelly, here available to answer these questions.
Perfect. We actually have a couple already in queue. And so I will present them, and then Marcel, you guys can answer these. The first one is, and I believe this is in correlation to when I was presenting one of the UWorld explanations. Explanations take a lot of time. How to tackle, even if the answers are correct. Marcel, do you want to take that?
Just getting myself in mute. Yeah, so great. Explanations do take a lot of time. And that is why we emphasize 2 times through the QBank. I think you've heard Dr. Devaney say that. I think you've heard Dr. McIntyre say that. I've said that either today or on prior QBanks. I know I've said that lots of times when I've presented at medical schools across the country and also abroad. This is a really, really important issue. A question bank, a high quality question bank, such as the UWorld question bank, is really a tool you want to use right away. It's not the dessert that you want to save for the end of the meal. It's the thing you want to get to right away. It's the main part. You want to tackle it and get to that right away. And the reason why is you want to leave enough time to get through those questions plus those explanations. And the way you're going to time that out is initially you're going to use it as a learning phase. You really want to make sure that you leave lots of time for learning and integrating. If that's going to take more time than maybe you're used to, that's okay on your first pass. On your second pass, we'll talk about that shortly. You're going to you're going to start to limit your time because you're doing it on a second phase where you've already learned that information. Now you're going to be consolidating that information in the second phase. In the second phase, when you're trying to think about a rule of thumb, you can say, okay, I'm going through these questions. For every minute I spend on a question, I should spend about 2 minutes on the review of the answers. Now, obviously, there are certain limits within that. If you're taking too much time, but that's an individual thing, and that's my general rule of thumb. I think maybe Dr. McIntyre, Dr. Devaney have some additional thoughts to add here.
Great, thank you so much. All right, and I think, Marcel, this was actually something you or possibly Dr. Devaney was touching on. How do you differentiate between a high-level stressor and low-level stressor? And what would be the signs that you are stressing too much?
So,
Caleb, actually, I was going to refer this to you, Dr. McIntyre.
Yeah, I can handle that one. So really the answer is that there's no hard and fast way to do it, right? We can't say, well, that's a 6.4 anxiety score. A lot of this is going to be telling within yourself. So if you feel like you are in an anxiety spiral where you are reinforcing your own anxiety, I know I have been here, especially during studying and at other times, right, where you're stressed and then you start to build on that, where you're stressed about being stressed and that makes you more stressed. And then you're like, oh no, now I'm not remembering anything because I'm so stressed. And then that stresses you out more, right? If you're in one of those spirals, that's a good sign that you should take a minute, step away, go for a little walk, something like that. When you do this, I recommend, rather than just taking a little walk around and then coming back when you can, set yourself a very specific restart time. So say it's 10:30 a.m. I find I'm just really more stressed than I want to be. I would set myself 10:45 is my restart time. I'm not starting any earlier than that. That way you get to come into it with a lot of intentionality rather than feeling like you're kind of just hopping on and hopping off. But yeah, the bottom line is that there's no hard and fast way to say this is more anxiety than is helpful for memory formation. But if you feel like it's in a cycle where it's building on itself, that's when I would step away.
Sure, thank you so much. All right, next one is in one elite medical prep, I'll send this to you as well. What is the ideal timeline to effectively study and pass the USMLE Step 1?
It's a great question. I'm going to turn this over to Marcel as well in a second, but I'll also speak to it. And it really it's very individual. I think I would recommend in general taking at least 2 months of very dedicated study time. Some people need more than that. Some people can do it in less. It depends so heavily on how effectively you think you've worked on your memorization techniques, right? What strategies you're using for tackling it. And certainly using more consistent, better directed strategies like we use a lot in our practice decreases the amount of time you need. It's tough for me to say an exact one, but usually I'd say at least a couple months is like a very, very broad strokes. Marcel, I don't know if you would.
Yeah, actually, I'm going to bounce this over to actually Dr. Devaney, because I think this is a great question, particularly since there may be a lot of people who are at osteopathic medical schools and preparing for both COMLEX and USMLE, and there's that balancing act. And obviously, Jim, you've had a direct experience with that, and also as a tutor and also as a student. So maybe you want to talk to that.
Yeah, thank you, Dr. Bruce Raymer. Yeah, I agree. I think having ample time, as Caleb was talking about, with overall prep is incredibly important. As far as prepping for USMLE and COMLEX, the goal is still to learn and understand the systems the best. That's going to be the bulk of the test. The COMLEX portion, though we do fear it will be a much lesser portion. It's present, but a much lesser portion. So the bulk of your studying should be focusing on the general medical topics. A lot of people decide to take USMLE first and then later take COMLEX and have the time in between, which is on the order of days to a week, to be specific high yield OMM topic review, which typically has worked out for all of the students that I have tutored. But if you have a higher anxiety level about trying to cram all of the high yield OMM topics into that time period, something that I've done in the past is kind of adding a day during your study week that can be dedicated more to the OMT review and topic learning. But the fact is that we all get great review, great learning just from having done it, participated, and passed the class. So yeah, that's what I would say on that.
Great. All right. So we'll go through a couple of these. We've got several questions coming in. And so we just want to be aware of everybody's time. So we'll try to get through these. Any recommendations for insomnia the days prior to the exam?
I would love to cover this one, actually. So this is something I chat about with all of my students in the week or two leading up to it. So the really important thing to remember about insomnia leading up to the exam is that all, like level 1, level 2, step 1, step 2, all of these tests are graded on a curve. That means that you are being graded on a curve against other students who, believe it or not, are also having insomnia because everyone gets anxious before the test. I know I did. I slept terribly in like the 2 weeks beforehand. So the first thing to remember is another one of those cognitive reframing techniques, right? Where if you get a crummy night's sleep before the test, you're in the middle of the pack. You're doing great. If you magically, and I don't know how you would do this, but get a good night's sleep leading into level 1 or step 1, you are actually at an advantage, like actively at an advantage. So what I recommend is, and this is from kind of marathon wisdom, is that for marathons, you always say it's not the night leading into the marathon, it's the one before that you want to get a good night's sleep on. I very much go by that philosophy. So if your test is on a Monday, Sunday night, you are probably going to get a crummy night's sleep, and that's okay. Saturday is the night when I recommend using whatever sort of, over-the-counter sleep aids are your preference, whether that's melatonin or like a Z-Quil or whatever it is. Use some of those, within moderation, of course. And that's because when you wake up Sunday morning, if you're a little bit groggy from that melatonin you took or something, it doesn't matter. The priority is just getting a good night's sleep, and that way you've got a good reserve coming into Sunday night. There are also a lot of practical little things you can use for insomnia. If you get, you can try some white noise apps, try a weighted blanket. This is a funny sounding one, but I swear to you, one of my friends who was pregnant during med school swore by it. Maternity pillows are fantastic for like comforting you as you sleep. It like gives you something to hold on to. She's like, yeah, that was like the biggest blessing of still having that for step 1 studying. A lot of things you can try out.
Yeah. I can say from personal experience, I'm a generally a fantastic sleeper, too good of a sleeper. Friends have been annoyed about that. Also my wife, but I also had a very difficult time sleeping. I know from just experience now, my own clinical work, that I oftentimes build up a sleep debt, but then I have at least one day a week off where I'm totally free of work and I catch up on sleep. And that can really impact you. That can really help you when you know you might have a sleep debt later on, like a day later. I could say one other thing that I love to do, and this maybe tie into resources, which I was talking about earlier. I love to find a boring book. When I take a book and I open it next to me and I read it, something not too boring, but boring enough, and I start reading, my eyes up to page 1.5, boom, they go right down and I fall asleep. I use this technique a lot. So a boring book can also be another help. Maybe that textbook that you didn't read, but you meant to read. I'm not going to name names here. There are lots of them that we buy in medical school that we don't necessarily need to review. They can be helpful to help you fall asleep quickly. So there are pharmacologic and non-pharmacologic methods, and I think Caleb outlined them really well.
Okay, perfect. All right, we've got several more questions. So I'm gonna do a couple that we haven't had anything like before. Aside from UWorld and the first aid book, what high yield resources would you recommend for effective studying for the step 1? to help the candidate understand the most important basic concepts being tested. So much anxiety we get from being bombarded with so many resources.
So the most important thing in my mind, and Marcel and Jim, let me know if you want to hop in for anything, but the most important thing in my mind is, just as you said, there's all this anxiety because there are 1,000,001 resources out there. I generally recommend sticking with UWorld as question bank, and I say that very genuinely. I just think the kind of quality of answer explanations is best. But UWorld First Aid as a learning resource is my go-to. And then if you're going to do a visual learning technique, I generally recommend Sketchy. There are, of course, there's flexibility kind of as each student learns, but the biggest thing is just picking a resource and sticking with it. There are a ton of resources out there. Most of them are good. And the biggest thing is not having 2 or 3 resources for each domain. So don't have 3 different question banks. Don't have 3 different video resources. If you're doing boards and beyond videos, do those. If you're doing Pathoma videos, do those. Just pick ahead of time and stick with it. That's the biggest thing.
Yeah, Jim, maybe you want to talk specifically with Comlex, any additional resources, or this sort of idea of like the resource creep that particularly might come up amongst students preparing for, say, Comlex and USMLE?
Overall, I think a lot of people use the Savarese book for review of Comlex, but in general, the questions are fine as a primary resource. I have, and some of my schoolmates had created a file that I typically share with people. So there might be a resource of high yield topics such as counter strain, sympathetic, parasympathetic, and sacral concepts that you really just need the high yield. This is important. This is good. Remember this type of thing. So sometimes those circulate through the university or other venues, and those tend to be super helpful and not overly bogging you down.
Great. Okay, let's go to the next question. And would you mind elaborating on how to best effectively use the flashcards during preparation?
I can talk about that because I've talked about this previously on some other talks. So some of you may be using the flashcard feature in UWorld. Some of you may be using an independent flashcard service. Before UWorld had a flashcard service, I would say by default would always be to use Anki. It's free. It has the basic algorithm you need. And that is basically, it's an adaptive learning technique, adaptive learning. That algorithm has been integrated into the UWorld flashcards, so you can do that through UWorld. You can also do that independently. That's really up to you. The key here with flashcards is you want to use them regularly, and you want to make sure that you are either making or editing them. Now, why do I say that? Well, there's this tendency, particularly with Anki, it's a great resource, and you can get all these decks for free, or you can share them. And there are all these decks out there that have 5,000 cards, 10,000 cards, 20,000, 30,000. I think there's ones that have 40,000 cards. Unless you are going to make a concerted effort to use Anki for multiple hours a day, you're not going to get through those massive decks, those mega decks of 20 and 30,000. So if you're going to use those mega decks or those decks that are pre-created, you're probably going to have to spend a bit of time upfront culling the deck down to those cards that you really need. So you're going to have to get rid of things that you don't find immediately useful. And you may also want to use flashcards if you're not one of those, you're not super favorite flashcards, use it particularly in areas where you're weaker. So it's going to involve a little bit of active involvement up front to get them ready. And then you're going to want to use them on a regular basis and make that a habit. If it's going to be your habit of half an hour a day, great. It's going to be half an hour twice a day, or it's going to be 2 hours a day or something like that. Try to see that habit. Just using flashcards for a short period of time, a week or two just before the exam, may not get you the benefit you want unless you're doing it on a very, very focused area. Because remember, when you're using adaptive flashcards, that's what the value is. It's going to show you the cards that you got wrong more frequently. So you're going to have to re-see those cards. Whereas the cards you got right, they're going to get pushed away. That's a very relieving effect. But those cards you haven't gotten right, they're going to see them again and again before you're going to kind of incorporate the other ones. So there can be this traffic buildup of cards if you're not clearing out cards by knowing.
Perfect. Thank you. All right, this is a great one, Marcel. What can be a comfortable MBME score to know you are ready to take the step one?
This is a great question, because MBME scores have now been changing the way that they've been producing the results. So in the old days, we would get these predictive scores where you'd get a scoring table, and then you'd have to then translate it over and get a predicted score. And of course, with step one, that is no longer on the table, really, because you're in a situation where it's just pass fail. So now you're going to be getting these percentile performance scales, and I think you're also going to be now getting an updated score report. And Caleb and Jim, I don't know if you've seen these. I have not actually directly seen this, these new tables, but you're now going to get an updated score report that's going to give you more detailed information about your performance. And really, what you're looking for are markers that are going to show you you're clearly going to pass. One of the problems that has come up in this last year or so is that we've had a lot of uncertainty, because the markers that they produced and the old test results that we used to rely on weren't reliable, and a lot of students who were on the edge ended up failing that exam. So it's become very, very stressful. I don't know, Caleb and Jim, have you had any specific advice as to the updated reports?
I would not say that I have much more specific advice beyond what you just went through. I would try to get around a 60% likelihood of passing is usually where I start to say, like, yeah, we're in a good spot. A lot of the schools that we work with will have some sort of initial, you need to get, often it's like 62% on a practice, like a CBSSA, a practice NBME, before they'll kind of give you the all clear to take the actual test. So not too much more to add, but around that like 60, like low 60s percentage is usually where I start to think we're in a pretty good spot.
Jim, did you want to add anything? I have one more bit to add on this, but go ahead.
Yeah, nothing specific. I think you both covered all I would have.
So if we want to dive into like a specific number, sort of percentage correct, right? As Caleb said, low 60s is where you start to feel safe. If you want to feel really safe, like you want and this is for the NBME, for the USMLE step one, you really need to make sure you're going to hit that 65% or higher. That's when you're going to that's you start to stamp down the certainty level. Every school kind of has its own historical sort of number that they've relied on, and we work with learning advisors and learning specialists across the country on that. So 65 would be my general rule, because I'm going to be a little bit more conservative on it, given this last year. Of course, if you're at 70% or above, you're going to, and that's consistently, you should be passing it easily. You shouldn't be worrying about the passing issue.
Okay, next question is, you were old enough to pass step one as it is now pass fail, especially if time is limited.
Yeah, I can answer this. Absolutely. I mean, from the standpoint, is it enough? And from a standpoint of a question bank, absolutely. I think this is, you only need one question bank. You need one good quality question bank. And good quality doesn't just mean good questions. It means good answers, explanations, not answer explanations that are totally comprehensive and cover everything. That's not what you need. You're not looking for a textbook. You need something that is going to hit the key points and let you get the information you need that you don't know, and that's going to start to address your needs. So yeah, it's by far more than enough, given that the pass fail. Interestingly, you say if time is limited. Now, what we're seeing, what I predicted when this first came out, is as follows. Now that step one is going to pass fail, many schools and many students are starting to shorten the dedicated time window for step one. So then time is now limited. So that emphasizes even further the need to get started with the QBank earlier. You cannot cram all that QBank in later. Saving questions, as I've learned from my co-founder at Elite Medical Prep, and who's actually listening in today, Dr. Rubin, saving questions is like the great mistake. Hoarding your questions for later is a huge mistake. It's like the number one mistake we see. So, I'm going to save those for later because I'll first get through all the material and then get to it. No. You need to start with the questions first and then figure out where your issues are, then learn. And then that's the way. It's the reverse of everything you've done up until this point in your higher education. You've always read the book and then prepared and then done the practice questions. Now we want you to do the reverse. practice questions with great explanations, of course, and then go back and learn the pieces that you're still not getting. And that's the methodology. And that's going to help you with the time limitation that's going to progressively get shorter. If your school hasn't shortened it yet for your dedicated, it's going to be doing that. I've seen that multiple schools on multiple thread listservs say that they're shortening their step one, level one prep time.
Great. Okay, we are at 12, so I want to be just aware of everybody's time. So we'll answer the last couple of questions that we have. Okay, is there a much faster method of creating your flashcards as it is a time-consuming process? Give you have a short and sweet answer?
I have a short answer. Yeah, the thing is, if you're going to use Anki, then you can input the cards, but you're going to have to then delete out a lot and be very sort of a little bit brutal. It's not doesn't fit your needs. Cut it out quickly. But the broader point is, it's going to take a little bit of time, and the time of building those cards and building that deck is a learning process as well. So don't think of it as just like, oh, that's something you have to get out of the way. Think of it as part of the process. Okay.
That's great. Okay. And then last one, would you mind elaborating on how to best effectively use the flashcards during preparation?
I can answer this again, Caleb and Jim, if that's okay. Yeah, so the way I think of questions and flashcards is kind of the same bucket. Active learning resources, something I want to be using all the time. So for me, I like to start my day when I'm preparing for any kind of standardized test with 5 standardized questions from QBank in tutor mode every morning with the morning coffee. If you want to, you could substitute that with flashcards. Do a half an hour of flashcards. Then if I'm going to do something at, say, my lunch break while I'm prepping, or in some other break time that I know I have, I'll do either flashcards or some questions. Probably if I do questions in the morning, I'll then do flashcards in noon time. Those are my best times. I like to be awake early. I'm freshest then. And then at the very end of the day, if I really want to squeeze in a little bit extra, I'm going to do my flashcards later as an active resource, because it's harder to do questions when you're really fatigued and do them meaningfully, right? But flashcards are really like mini questions. As I learned from Caleb over the years, you have to think of a flashcard as a mini question. And so it's like a way to use it as a mini question. Sorry, Caleb, I'm stealing your lines here, but in interest of time, I'll stop there.
No, I love it. I love it.
So yeah, it's like, I've learned a lot from Dr. McIntyre over the years, and of course, Dr. Devaney and all the team here. We have at Elite Medical Prep and the people at UWorld.
Great. And then Marcel, there's one question that I in the chat bar that I think you should just answer privately. If you would just look at that when you have a moment.
I will do that. Yes, thank you so much.
Perfect. Okay, I think that is all for today. We really appreciate everybody joining us, and we appreciate you spending the last hour with us. Thank you, Elite Medical Prep, for being with us and taking time away from your busy schedules. If anybody is interested in the recording, it will be emailed out tomorrow to everybody who participated in the webinar. If you have any other questions, please always feel free to reach out to us at UWorld at medicalsales@uworld.com, and or Elite Medical Prep. Marcel, if you want to share contact information.
Yeah, you can reach us at info@elitemedicalprep.com. That's INFO at elitemedicalprep.com. One word. And yeah, that information should be in the email. There'll also be a follow-up email that should have a link to this recording so you can watch it again, and also share it to any colleagues who may have missed it. There's also going to be a YouTube recording that should go with this, since this has been a live stream on YouTube. Kelly, thank you again. And UWorld, thank you again for having us. And Dr. McIntyre, Dr. Devaney, thank you for joining us. This was excellent, and I've really enjoyed this. Thanks, everybody.
Same. Thank you, guys. Bye.